Police and health officials in the Okanagan region of BC are sounding the alarm. This comes after 5 people died of overdoses in the span of 9 hours on Saturday. The deaths occurred in Kelowna, and police say officers responded to 3 different locations. The RCMP are asking anyone who uses drugs to be safe by never using them alone. They also recommend using at safe injection sites, testing drugs before use, and carrying naloxone. Meanwhile, BC officials continue to battle a toxic drug supply in a province that sees an average of 6 deaths per day, according to the Provincial Coroner Service. Well, joining us now to tell us more about the situation on the West Coast is Guy Felicella, peer clinical advisor with the BC Centre on Substance Use. Mr. Felicella, welcome to Forum Daily.
Thanks for having me.
Now, what do we know so far about the 5 overdoses on Saturday and the people affected?
Well, I mean that they died alone. Some died in their residence. It's just ongoing. Tragically, an unpredictable drug supply is just continuing to increase, which is, killing a lot of people in our province and our country.
Now, as you said, these deaths happened alone, and according to the coroner's service, about 84% of illicit toxicity deaths occur indoors, while 15% occur outside. So, how do we address an overdose crisis if they are primarily hidden from the public?
Yeah, it's a good question. I mean, it's really hard. I think there's so much, stigma and discrimination around substance use in our society, depending on where you live. And that drives people to use alone. I think one of the things that definitely needs to happen is that if people are using alone in their homes, that they should have access to, safer substances with known controlled doses that they know that they're consuming. Because really, what's killing people is not knowing what they're taking. It may look the same one time, and then they buy it again, and it's not the same, and sadly, they succumb to it.
And what do we know so far about the demographics of those most impacted in the province?
Well, Indigenous people are disproportionately impacted by it, but also after that, I mean, it's really, in every community, it can be anyone. There's a lot of here, especially, the trades industry is impacted highly by substance use as well, and so there's people with that are using in their private residence. They have jobs, families, but unfortunately, there's no margin of error anymore. And 78% are males, and I think one of the biggest reasons with that is that males don't like to talk about their struggles, and so they die in isolation.
Some very heartbreaking facts there. Now, the RCMP and officials are promoting using supervised consumption sites. So how do these sites differ from private or personal residences in terms of comfortability and safety for the user, especially when it comes to users from minority communities, as you mentioned?
Yeah, no, it's extremely challenging to access a supervised consumption site when there isn't one in your community as well. And so a lot of the places where deaths are being impacted by overdose, there isn't a supervised consumption site. And if there is, sometimes people, are just uncomfortable using them, for various reasons. Obviously, it could be, beef on the street, but also too, if somebody's not, having problematic substance use as well, they're not going to use a supervised consumption site. Their intermittent substance users are people who can die as well. Not all people who are using these substances have an addiction to them. There's a lot of people that just use substances in our society, and for them, they're at an extremely high risk as well.
All right, Mr. Felicella, about a minute left here, but what else is missing here in terms of addressing the overdose crisis in BC?
Well, first off, I think people need access to safer substances. And, when you hear a safer supply out in British Columbia, I mean, yeah, sure, for some, but not everybody can access it, especially if you don't have a substance use disorder. And then also, too, for people that want to stop using, the access to get into treatment and detox is, a wait list. And so, these wait lists, while people are waiting to access services, sadly, they still are using substances. and dying because they're waiting, or after they finish detox after 7 days, they can't access a treatment facility for an extra couple weeks, and they're supposed to now leave detox, go back to the same environment that they left, and white knuckle it until a treatment center opens up. And so that's just, there's so many gaps in the system that need to be repaired to move people forward quicker.
Lots of important points to consider, Mr. Felicella. Thank you again for your time today.
Thank you, Nima. Have a great day.